I have been compelled to just give my views over the statement by His Excellency the President when he addressed the nation this afternoon. I am extremely shocked and disappointed that as Zambia, we seem to be treating the COVID pandemic with kid gloves. And I feel that as a nation, we are not being serious and our leaders are not being realistic. Countrymen and women, since this pandemic started 3 months ago, we've always been recording 2 cases to the most 4 cases in 24 hours. Today, we recorded 14 new cases in the last 24 hours. Secondly, we are made to believe, I beg to be challenged, that the COVID-19 virus thrives very well in cold conditions. Now, the numbers of COVID in this country have been increasing steadily, and we are going towards the cold season. I feel that it is extremely unreasonable that we can start relaxing public health regulations at the time that the numbers are going up, and at the time that we've started recording more cases in 24 hours than ever before. The issue of opening schools is another issue where I feel it's carelessness to do that. Reason being that if indeed it is true that the COVID virus thrives better in cold seasons, why should we take our children, even if they are in examination classes, to the war front? Look, when you look at the government schools, our government schools, one classroom has up to about 75 to 80 pupils in one class. And then we are told that this virus thrives well in cold conditions. What are we saying? We are saying we respect the examinations that are coming. Go, you children. We don't care about your health. Go and be 70, 80 in one class, because the size of classrooms, and if you take 80, 70 children, how can you do social distancing? I don't think we're being serious. And I've seen some people have celebrated that President Lungu has done very well to do what he has done. People of Zambia, I beg you. My fellow parents, I beg you. Don't take this pandemic as a by-the-way thing. This disease is serious. In any case, I am convinced beyond reasonable doubts that the numbers that Dr. Chitaluchilufi has been giving us are not correct. And the reason is very simple. Out of a population of 17 million Zambians, tests done so far is only 800 plus. It is just a small drop in the ocean of tests that have been done. Meaning, therefore, that if we did more tests across the country, and by the way, those 861 cases that we have tested, 99.9% are just from Lusaka. Have we tested the people on the Copper Belt? Have we tested the people in the other 9 provinces? The answer is a big no. Therefore, it is unreasonable for anybody, and mark this word, to start relaxing the COVID regulations that were put in place at the time that the numbers are increasing, like I've said. Look, when they started this random testing in Lusaka, we have seen the numbers going up and the numbers per 24 hours increasing, which shows that if we were to test the whole country, the numbers we have are well above 5,000 of people that are carrying the disease. Now you are asking these children, 8 in one class throughout the country, to go and infect and reinfect themselves. Then they come back and interact with those other children in society. The spread of this pandemic will be unbearable. My appeal to the president, please rethink this decision. For me, my wife and children are in the UK. And the way they've told me what is happening in the UK in terms of this pandemic, you can shed tears. And I don't want the people of Zambia to be subjected to what the people in England, what the people in France, what the people in Italy are going through. And by the way, people of Zambia, when I first issued a statement on COVID, I raised the point that we only have 12 ventilators at UTH, which fact has not been denied by the Minister of Health. If I may ask, for you to relax these COVID regulations, have you procured more ventilators? Because like I've said, there is no cure at the moment. The major equipment that can help you reduce deaths or avoid COVID deaths is only a ventilator. It's only a ventilator. Now, if you don't have the ventilator and then you're asking people to go and test, it's like poke and see. What we're doing is like poke and see. Let's see if these people are going to die. And when they die, then we can take action. It's a very wrong way of thinking. It's a very long way of leadership. And I think those who are advising the president and the government on this issue must rethink what they are exposing Zambia to. Secondly, we don't have the equipment. We don't have the facilities. We don't have hospitals that can fight COVID. Once this pandemic goes in the peripherals, in the compound, people of Zambia, ukabe chidilo, lusambu sambu, no shalimo, akabamo. Mwelesa wesu, ushetu alilowe kwa kanshualo wa Zambia nani. What we are making these decisions. The president goes on to say he has opened up casinos, restaurants, but he has remained, the bars and the taverns are closed. What is the difference between a casino and a bar? What is the difference between the restaurant and the bar? Because even when you go in the townships, you go in the markets, there is no social distancing to talk about. So if you are so much worried about the effect of the economy, it's better you open all the businesses, because it's like you're advantaging others against others who are doing one and the same business. What is going to happen now is that people will flock into the restaurants, because restaurants sell beer. The restaurants have got a license to sell beer. The casinos have got a license to sell beer. So what the people will just do, in the afternoon they will be in restaurants, have a little bit of beer. In the evening they will go to the casinos. And there will be no social distancing. Please, in government. Please, my brothers in government. Let's be reasonable for once. Let's not create a situation where people would think that the casino owners have played their part in this decision. Because surely, You close a bar, you open a casino. Where is the reasoning there? I don't see any reasonable reasoning there. The cinemas. You know how people sit in cinemas? It's one after the other, one after the other. What social distancing are they going to do in the cinemas? We all appreciate that there will be an effect on the economy. And that's why I said in my previous discourse, I'd said that it is not just a question of a lockdown or a partial lockdown. The lockdown should have been done, or the partial lockdown, in consultation with the stakeholders who are in this, who in this case are the owners of the restaurants, the owners of the bars, the owners of the hotels, so that we can come up with incentives to cushion them. But what we did was an upper hazard thing. We just said we have closed bars, we've closed restaurants, we've closed the hotels, we've closed casinos, without coming up with an incentive or a package that is going to cushion their business. That was careless. Today I was reading in the paper where Diego Casino and McDonald were analyzing the effect of the pandemic. If you follow closely what the two businessmen said, they were not asking for relaxing of the COVID conditions. They were asking for incentives in order for business to break even or survive. This thing has been done not in good faith and wrong timing. We are going in the cold season where we've been told that this virus thrives better in cold conditions. That is when you relax the conditions. What are we doing? I wished government could have waited even for June, to the end of June and see the effect of the cold season on this pandemic. But surely we are sending our people to the grave. We are sending our people to the grave. And where I come from, we say, uko alinsoke takwafuile bantu. Elo kabili na likwevele nao tabulapo. This decision, in my view, is a wrong decision. We should have waited to see how the cases are going. You are not even scared that in the last 24 hours, we recorded 14 cases. And like I've said, if we were to test this country like other countries are doing, I can tell you that the numbers are well above 5,000. And to send people back in the restaurants, normal life, back in the cinemas, back to school, is a miscalculation. It's a miscalculation of the worst kind. With only 153 cases, we are failing to provide the few medical staff who are in the front line to fight this COVID with PPE. Personal protective equipment. We are failing to give them personal protective equipment, proper. Now, if this pandemic goes to all hospitals, what is going to happen? Already when we are just about 50 cases, 70 cases, if I'm not mistaken, 9 of them were health personnel who contracted the disease because of lack of proper PPE. We've seen so many donations, but you saw a health worker being put on a bus, a public bus, with COVID samples. Now, if this pandemic gets out of hand, how many such incidences are we going to have? Elo kabidi, mule kwata kone insoni. I have said and I want to say it again. Insoni ebuntu. You send that young man, may his soul rest in peace, on a public bus to deliver samples. When he dies, you airlift his casket to Mpika, and ministers also pick up another helicopter to fly to Mpika to bury him. Now, if you had airlifted that sample from Zambezi to Lusaka, were you going to spend money to airlift the ministers and the body to Mpika? The answer is a big no. But this is how careless we are as a government, how careless we are as a leadership. And again, we've gone back to the same carelessness. Frontline health personnel who are being kept for 30 days without seeing their families are not being given any incentive at all. 3 months on the line. They are working 14 days, then they are quarantined for 14 days at the same center. So for 30 days, they don't see their families, sacrificing, and then they are not being given anything. Now, if this pandemic goes out of control, are you going to manage to pay the frontline health personnel any allowances at all? These are issues that we should be thinking of. Other than just making decisions for the sake of making decisions. I like the statement when the president says we should be acting as Zambia, not a copy and paste from other countries. But we have to, what we have done by relaxing some of these things is copy and paste. Because other countries have started relaxing. But in terms of medical facilities, in terms of ventilators, in terms of PPE, they've got it in abundance more than us. What are we doing? You know, let us not make statements, flowery statements, just to try and impress the listeners when we don't mean what we say. Countrymen and women, my brothers and sisters, this decision is not in the best interest of the people of Zambia. And I can promise you, mark my words, we are going to have a very big problem. If indeed the virus thrives in cold conditions, because we are going in the cold, and already it's becoming so cold. Nani alo wa Zambia for us to be so careless? By the way, who is going to be given sanitizers to all the schools? Who's going to be given the masks to all the schools? Because the masks are disposable. These Chinese masks are disposable. You wear it once and you have to go and dispose it. Even the following day when you go to school, you need another mask. Who's going to provide these masks to all the schools, including those in the rural areas? And like I said, 80 pupils in government schools in one class. How would they do social distancing? And I would want to find out who are the beneficiaries of the donated equipment. Because the hospitals are saying they don't see these donated equipment like masks. Nurses don't see them. Doctors don't see them. The community don't see them. So where are these donations going? Yesterday I was reading their examinations, or they are just going to write in June. Because all the countries, the calendar, the education calendar has been disturbed. And we have with plan B, and the only thing is to risk our children against this contraction of COVID. I want to appeal to the president to relook at what he has announced today. For me, one, it is wrong timing. Secondly, it is segregative, it's selective, because you open the casinos, you open the restaurants, you open the cinemas, then you say the bars and taverns are closed without giving them incentives to survive. To me, this is poor leadership. God bless Zambia.